Good morning, Deb. How are you?
Great. I'm so glad to be with you today.
I'm so happy that you're here, and thank you for taking the time to join us on Rare Awareness Radio. I know you're a busy person, as we were just talking about before we went on air. There's a lot of balls in the air, so I appreciate that so much. But we are joined this morning by Dr. Deb Ondrasik, and I'm so excited to speak with you and learn a little bit more about what you have been doing. This is part of a longer series, as you and I talked about, that we are doing focused on CACNA A1A. And I think that there's a lot that you and I can get into. So I'm really, really appreciative of your time. So thank you once again.
Thanks for having me.
Yeah, absolutely. Um, I think we'll start off with you've dedicated your career to pediatrics. You are a pediatrician, but you're had a kind of change to your professional world,
Mhm.
your personal world, when your daughter Gabrielle was diagnosed with a rare disorder. Can you talk us through a little bit, kind of that moment, how it sort of shaped things for you from that moment going forward? I think both as a physician, but most importantly as a mom.
Yeah, absolutely. So correct. So I'm a pediatrician. I trained in the military. So I trained in Hawaii, was married for about 8 years. And then my husband and I started to have children.
Mhm.
And my first pregnancy was very much uncomplicated. And my daughter was born full term, didn't go to the NICU,
Mm.
really had a very normal first couple months of life, fed well, gained good weight. And then within about 2 to 4 months, we started to notice missed milestones. And so, of course, they're very subtle. As a pediatrician, I try not to be that mom who is like, my daughter has to hit every milestone on time. I know there's a spectrum and some kids are later. And so I tried to really wait. But by 9 to 10 months, it was very obvious that she had significant delays. And so, um, we went forward and ended up getting evaluated by early intervention. And of course, I think that I knew how to navigate the system as a pediatrician. Like I knew that was the first step, pretty much, is get early intervention to do a full evaluation. She was diagnosed with global developmental delay that was so significant that they suggested that she get an MRI, which I wasn't quite sure about, like jumping to an MRI, and I was kind of trying to just grapple with that new diagnosis. And then she went on to have over an hour long seizure, status epilepticus. At that point, she got the MRI, which was abnormal. She went on from age 1 to 2 to develop epilepsy. And because of our insurance, we had military insurance, as wonderful TRICARE, and because I'd worked in the military system, she was able to very quickly get to her diagnosis. So we did not have the long diagnostic odyssey that many families encounter when they're dealing with rare diseases. And so she, at 18 months, was able to see a lot of specialists, developmental, neurology, genetics, and right from the beginning, it was offered to get whole exome sequencing for Gabby. Wasn't something I had to fight for, which again, I always point out is very unusual. But that's my passion, really, is that every family would have the same story that I have, that when a child isn't meeting their milestones and they're having these delays and now they're having seizures, that there would really be that comprehensive evaluation to figure out, why is this child not developing as we would expect. So she ended up getting diagnosed with CACNA1A epileptic encephalopathy. And at the time, we were told she was so rare. They told us 8 in the world, the only one in the US. That wasn't necessarily true, because there are different labs, doing tests, and they don't always communicate. And so, but there's no foundation. And so we were very much on our own. And for the first, she was born in 2013. I would say for the first 7 years, we were just on an island by ourselves. I was still working as a general pediatrician. But honestly, I was just I had 2 more kids and was just like mostly doing the mom thing and the general pediatrics thing, and they were very separate. And then our foundation was formed in 2020 by some fabulous moms, who I think you're going to speak with some of as well, or already have. And I was really motivated to try to use my voice. And I was struck by the fact that I was a general pediatrician, and maybe somebody would listen to me because I was not only a mom, but also a pediatrician. So I started to really look into how could I use my voice? How could I raise awareness? And decided to dive into just trying to increase access to genetic testing so that every family would have the same story we had, where there isn't a long diagnostic odyssey and they get the why much earlier to
Mhm.
then get connected to community and services and maybe medications. And also just to really advocate for more education of physicians. And so I've been really working to advocate within the American Academy of Pediatrics to really educate physicians.
Mhm. And Deb, there's still a hesitancy, right? I think there are parents, there are providers who potentially have a hesitancy towards early genetic testing, and
Hmm.
you've done a lot of advocacy in that place.
Hmm.
What do you say? I mean, what do you say to folks who are hesitant or unaware of the importance, especially in diagnosing rare neurological and neurodevelopmental conditions like CACNA1A? I mean, what is the approach that you take with them? I'm curious.
Yeah, so there's so many biases and there's so many reasons, and so I think there's lots of barriers to overcome.
Mhm.
Initially, the barriers were testing capability, right? Like it was really hard to do the test. There weren't a lot of labs doing it, but at this point, there's so many labs doing it that there's really like labs are ready and able to do it and to do it quickly. And then it was insurance coverage, and so certainly, as a physician, you're trying to worry about, is insurance going to pay for something, or is this family going to get hit with a very large bill, and is it worth it, right? And so if there's not going to be a something specific that we can do for a treatment, then maybe we don't want to spend thousands of dollars on a test. But at this point, there's so much improved insurance coverage that in many cases there are labs ready, there's insurance coverage, but there's not physicians ordering. And I think that there's many reasons for that. I think that some of it is just the science is moving so fast that doctors don't know, because what we did 10 years ago is different today. What we did 5 years ago is different today. So it's changing like every year, and it is hard as physicians to keep up with all these changes. And so the science is moving really fast. There's a lag in teaching physicians. And so I think the first is just saying, hey, labs are ready, they're able, and and it's covered by insurance. Like that's just like low bar kind of the beginning. The next step is kind of training on how do you order, and it is a complex system to order. It is not easy. It's not straightforward. There's barriers to the ordering process in terms of, usually for most tests as a physician, we refer, we order imaging, we order labs. It's all done in our electronic medical record system. And now you have to order it through a specific genetic testing company, and it's really complex, and it takes a lot of extra time, like maybe a minute for one test and an hour for another test. There's also training in terms of like a proper consent. It is really important to consent properly, and I'm really passionate about making sure that families are properly consented, because it's not a simple test. You're typically testing the child and both parents and looking at all of their genes. And so that's can have a lot that goes with that. That's important to consent. And so there's reasons that not every pediatrician is ordering this. But I also think there's biases, and I hear this from other families that I take care of as a pediatrician. I hear from other families in our community where parents bring up concerns, and the doctors think, no, that the parent's not right. The baby's fine. They're not listening to the parents. They also often think like, oh, you wouldn't want to know. I've heard that before. Like, you wouldn't want to know the diagnosis. And so there's a lot of paternalism where the
Yeah.
physician feels that the parent wouldn't want to know, when if you talk to the parents, almost all parents do want to know. And some don't. I've had some that don't, but I think it should be the parents making that choice. Do they want to do the testing to find out a true underlying cause, or do they not? And so, yeah, I do hear a lot of biases. And then the last thing is just, get asked this a lot, like, well, if you find out the answer, what's it going to do? Like, there's not going to be a specific cure. And I think I really want to get away from physicians doing testings just for cure, and think about it more for improvement in that child and that family's life, improvement in health, and treatment options. It might not be a direct cure, but there's so many treatment options, like improved access to therapy, improved access to supports in the school when you get a diagnosis, and then connection to community,
Mhm.
ability to get involved in research, and also maybe some medicines that will modify. So, a lot of times with epilepsy, for example, once you get the underlying cause, we're not going to have a cure that takes it away, but we might have better knowledge to make a better choice when it comes to medication management.
It's interesting, Deb, what you said about uh, um, the overwhelming aspect of this from a provider perspective. I was actually reading
Hmm.
a piece yesterday. Johnson and Johnson did a survey of oncologists, and like something like 75% of the oncologists that they surveyed said they're overwhelmed by the pace of innovation. They're overwhelmed by
Hmm.
the pace of drug development. They can't keep up with it as much as they try, right? So it's interesting to me what you were saying about the how the pace of innovation and the pace of change makes it that much more challenging, right, to think about as well.
Absolutely. And I think that, as physicians, we have gotten to the point where a lot of times we make decisions based on guidelines or algorithms. And I think that those are important. I think that that does direct the patient. Like when a child is delayed, what do you do? And I think that general pediatricians are experts at noticing a child with delays. We, at every single visit, 2, 4, 6, 9, 12 months, we're checking development. And I think that we really need to recognize that we are the experts in childhood development. We see the wide span of kids and we see a lot of normals, and so then we can pick up abnormals, but then it's what do you do? And I think that in the past the answer was, well, they have delays, get them into early intervention, start therapies, and I think we're really good at doing that.
Yeah.
But now the difference is look for an underlying cause, where
Mhm.
in the past there really wasn't an underlying cause found in most cases of global developmental delay. And now we're looking at, sometimes as much as 40% of cases, depending on how severe they are, that you can find an answer. And so it has changed rapidly. It's like a paradigm shift. And so then it takes time for doctors to catch up. I think that the most important way to get doctors to catch up is for societies to update guidelines based on updated research and evidence based medicine.
Mhm.
And then when there's guidelines, then just making sure that you're training physicians on those new guidelines.
Mhm. You mentioned the real importance of the connection to community, right? Even during this
Mhm.
process, you're saying how, even if you don't want to know the diagnosis, it's maybe important for them to know the diagnosis because of the connection to community. I want to talk a little bit about the role of the foundation, the role of the
Mhm.
CACNA1A Foundation. You sit on the board. You helped
Mhm.
launch the Team Gabby
Mhm.
5K. I love me
Mhm.
a good 5K. There's nothing better
Mhm.
in terms of like getting people to do something that's physically active but also promotes a good cause. Talk to me a little bit about the foundation and the building community that you've done,
Mhm.
and I think also,
Mhm.
Deb, how you've pushed forward a lot
Mhm.
of the understanding, because community is everything, right? As I talk to so many rare disease advocates like yourself, that and you're such an interesting advocate because you're a physician plus a caregiver plus a
Mhm.
mom.
Mhm.
How do we continue to push forward the research and the understanding through these foundations?
Yeah, there's so much that comes from the foundations. It's absolutely unbelievable. And I really have the experience of living two lives.
Yeah.
One, having a child with a rare disease without a foundation and being completely alone. And I remember just constantly thinking, man, I wish that Gabby had something like Down syndrome, because then I can meet other Down syndrome parents, and those that are further along than me can tell me what's next.
Help
They
me.
could give
Yeah.
me some guidance to know, how do I raise this child well, and how do I prepare well for her future? Because I think as parents, we really want to be prepared for the future, to be able to be ready for whatever comes next. And I remember wishing, yeah, that we could do like a 5K walk with the Down syndrome families and have that connection. And we were all alone. And so when the foundation came, it was really a whole different ball game in terms of what it did for me. And yeah, talking about that 5K, like, the 5K is good for my daughter, like for my daughter to see people there. It's
Mhm.
good for her sister. It's good for her brother. I'm a crier, so I might cry. It's good for parents. It's good for grandparents. It's good for aunts and uncles. It's supporting all of us, and so
Yeah.
it's really supporting the whole family. And so when you have a child with a rare disease, it doesn't affect just that child; it affects the entire family. And so the foundation provides community and support for everybody in the family.
Yeah.
So one of my concerns, I mean, I could go on and on. I mean, one of my concerns is the siblings. Are the siblings going to feel alone? Are the siblings going to feel that they have support? How are
Mm,
they going to navigate taking care of an adult sister after we're, you know?
mm.
And so this past weekend, I took my 10-year-old daughter away for a weekend with another mom and
Aw.
her 10-year-old daughter. And we had a weekend together. And both of these girls have sisters with CACNA1A.
Oh,
That's
wow.
what happens when you have a diagnosis.
Yeah,
Is what comes with community. And that's priceless to be able to give my daughter somebody who understands her, who's in her shoes, and hopefully they'll walk life together. And then for me to have a mom to talk to, is just life changing. On one of my 5Ks, I remember another family came. They're from Massachusetts, and I'm a pediatrician, but I still don't know everything. And
sure.
they said, "Well, what are you doing for a safety bed for your daughter?" And I said, "I don't, it's so dangerous right now. Sometimes she can fall out of bed, get out of bed. I can't be with her every single second." They said, "Well, why don't you get a cubby bed? My son has a cubby bed. It's wonderful."
You're
Those
like,
are the sort of real practical things of a
right.
safety bed that you learn from another mom. You don't learn that from the doctor typically. And so you learn from each other. On top of that, yeah, you get to do research. You get to be involved in research. In CACNA1A, we are a interesting community where not everybody in the rare disease has the same variant, and so not everybody has um, other people that have a similar picture. It can present in lots of different ways,
Sure.
but Gabby's is one of the most common variants. So she has A713T, so it's a specific point. And we have now found approximately 12 other children with the same exact variant as Gabby all around the world. And we're in a group text message and we share information with each other about, is this a seizure? Is it not? Because they look different. We show each other videos.
Mhm.
We ask about meds. Have you tried this med? Have you tried that med? What therapies have you tried? Another thing I learned from the community is intensive therapy. Kids in our world do really well with intensive 3-week everyday therapy versus once a week therapy. And these are all the things that
Yeah.
really, really take that child to getting excellent care.
Mhm.
That really can't happen when you don't have a diagnosis. The beginning is the diagnosis.
Mhm. Well, and that the complexity too, right? And I'm marveled at what you just said about like how you are all lifting each other up in all of these different ways, whether it's medically, practically, technically, emotionally. It's outstanding. Yeah, it really is. I
Yeah.
I was trying to not sound like, cutesy, but I was thinking before our conversation about like how you live on both sides of the stethoscope, Deb. That's kind of how I
Mm.
put it in my brain. Like you're on both sides. You're the
Yeah.
parent of a medically complex child. You are a practitioner of medicine. When
Mhm.
you're working with families that face undiagnosed conditions or rare conditions, do you have a different approach with those families? I'm curious as to how you manage that.
Yeah, yeah. I think that I do have a different approach. I work in a practice with a varied group of pediatricians. Some
Mhm.
are older than me, some are younger than me, and then we have some nurse practitioners. And so I kind of can see like what the kind of standard of practice is.
Sure.
Like good, I work with wonderful clinicians and what their understanding is and what my understanding is. And so I'm in this world of I understand genetic disease, the impact of a diagnosis, and how important it is. But if you're not affected, then you generally don't understand
Right.
the importance of genetic testing or the need for it. So I would
Mm,
say just based on talking to other general pediatricians, especially the ones I work with, that they really weren't aware that, oh, children with epilepsy should get genetic testing, children with global delay should get genetic testing.
sure.
Now that they've been trained by me, they're sending them to me and we're ordering testing in our office. So I do order whole exome for my patients.
Mm,
Um, but then also there is, I do feel like I can very much relate emotionally to what these parents are going through. So when I have families come in, I'm really looking at the whole picture. I'm making sure that they have enough therapies, that they have the support, that they're getting their safety beds, that they're getting their diapers, that they're signing up for disability if they're capable in this state. And so, I think that I like to offer those things. And then when it comes to genetic testing, um, I really started with do I feel like all kids should have the same opportunities as my daughter? And it's absolutely. I think every family should know about
yes,
genetic
definitely.
testing and be offered it. And I
Mhm.
think the problem is that families come in, if they're not physicians and they haven't trained in this, they would not know to ask for
Yeah.
genetic testing. right? And they're coming to the doctor, and they're expecting that the doctor is going to be offering evidence-based, up-to-date medicine. That would be their expectation. But in many cases, they're going to the doctor. The doctor is not offering the testing because they're not aware, because there's not guidelines. Like the doctors haven't been trained, and so because of all these issues, right? It's happening so fast. It takes a long time to develop guidelines, and so they're often not offered the testing. And so when I um, decided that I really wanted every patient to be offered testing, then I had to figure out how to get that done. And so then I had to get trained on genetic testing and or figure out how to refer to my local geneticist, which for me is Boston Children's. But my fear is in the coming future, there's going to be more and more referrals to genetics. And then there's going to be longer and longer wait times. And then there's genetic treatments coming out. And so I'm worried that in the future, we're going to have delayed testing that's going to have a negative impact on care. And so I think we're going to have to come up with a solution to streamline the process.
Yeah, sounds like it. I mean, again, you were very fortunate in the sense that you had access and the ability to pay for these things through TRICARE. I worry about equity, right? I'm sure you do as well, and
Absolutely.
streamlining
Hmm.
it and making it in such a way that we have the accessibility for everyone that needs it, regardless of ability to pay and all those things. And I know foundations like yours are really focused on that advocacy and policy development to that end. You kind of mentioned just a second ago, Deb, about some of the it's moving fast, and of course there are new genetic therapies that are coming and being
Hmm.
released all the time. Are there specific either trials underway or studies or emergent therapies that kind of give you a refreshed sense of hope right now, Deb?
Hmm.
Is it still a little bit convoluted? We have talked to some researchers in this space who are working really, really hard.
Hmm.
I'd
Hmm.
love to hear your thoughts on sort of the future of some of the science on the horizon.
Yeah. So, as a physician, I have been shocked at how quickly science is moving. And as a mom, I am sad at how slow it is moving. And so, when back in probably 2015 or 2016, I had a conversation with my husband. I said, I just at this point have no hope that there would be any real treatment or cure for my daughter because it's in her DNA. It's a genetic disorder. There's not going to be a solution because in 2015, we were really far away from where we are now, 10 years
Yeah.
later. And so when I saw the foundation on their website in writing, I remember reading in 2020, 2021 saying, we're in search of a cure. I couldn't believe it. In 2015, I would not have thought that would be possible. And now I'm seeing that there are treatments coming already and also treatments in the pipeline. I think of one of Duchenne muscular dystrophy. I mean, I think that's such a beautiful
Sure.
story. We know about Duchenne muscular dystrophy. It's this progressive disease that ends up taking boys' lives, typically in their teens or early 20s. And you can just see this muscular degradation over
Mm.
time. And there was a mom who just fought to raise awareness and to raise money and to get researchers on board. And now there's treatments. And so I think it was summer of 24 that became a possibility. And to me as a pediatrician, that gives me so much hope. And as a mom, it gives me so much hope. So yeah, we have a lot of research ongoing. For Gabby in particular, there's a stem cell line with her variant.
Mm.
There's a mouse model with her variant. We're studying different medications on the mouse model. And
Sure.
then there's researchers who are really trying to look at if there could be more of a true cure where we actually are doing genetic modification. And
Mm.
I think all of that is super hopeful. And I definitely see it coming very, very soon. But for my daughter, not soon enough, of
That's soon enough.
course.
Yeah.
My daughter is 11, almost 12.
Okay.
And so as a mom, I do have this sense of like, is it going to be too late? And I have people ask me, like, well, what would happen if you did get a treatment, like a genetic treatment? And I think maybe it could stop her seizures. Maybe it could halt her delays because I think that she's ever so slowly having more and more delays.
Mhm.
We're losing eye contact. We're losing vocalizations. Like maybe we'll stop that, and hopefully we would get gains, right? If we stop the seizures, then the brain can actually have time to work on learning new things.
Mhm.
But then I'm really passionate about thinking about the kids coming behind Gabby, and so I think about this little boy last summer, 9 months old. diagnosed with CACNA1A after a long seizure. And I think, man, he's 10 years behind Gabby.
Yeah.
We have to give him a better future than
Mhm.
Gabby. Like,
Mm.
it might be too late for my daughter
Right.
to stop because she's had 11 years of severe seizures.
Yeah.
But for this little guy, he's only had a couple. So I just am fighting for cures for the kids coming behind Gabby.
Thank you for saying that. I know it's not easy, and you have done so much to give hope to others, and you mentioned too, Gabby, like, sorry, Deb, not Gabby, Deb. You mentioned how you have built resilience through these support systems, right? You mentioned
Mhm,
the
mm,
foundation and community, and that's the one thing that I always really stand in awe when I'm speaking to rare disease advocates like yourself is how the community is so important. But for those that can't find their footing, I mean, the newly diagnosed,
mhm, mhm,
there is there anything that you would say to those folks? Is it just don't give up hope, keep trying to find that footing, or is there some way that you've approached folks in the past that are just starting, let's say, their journey
mhm,
with
mhm.
CACNA1A?
Yeah, I think that
You mentioned
everybody's on their own journey.
yeah, yeah.
Yeah,
You just
I
mentioned the
think that
case of the child. Sorry. Yeah.
yeah, yeah, I
Yeah.
think that everybody's on their own journey, right? And so I think that there's some moms who I've seen in the 10 years of being a rare disease mom that they get the diagnosis and like that night they're up researching, that night they're contacting the foundation, they're on the phone the next day with the president of the foundation and they are like all in and they're for it. And
Mhm.
then there's others who take years to get to the point where they want to reach out to the foundation because
Mhm.
they're either overwhelmed with the diagnosis or they're grieving the diagnosis
Mhm.
or they just aren't ready for whatever reason and all of that's okay. Whatever somebody's journey looks like does not need to look like somebody else's journey.
Mhm.
And so I think that there's different paths. For me, I was really busy with raising three littles and I didn't have the capacity when I had kids under 5 years old. It wasn't until my youngest was about 4 or 5 years old that I started finding time and space because they were all at school to be able to find a way to find my voice. And then at the same time, though, I would say I all of us feel like, well, who am I? Like, who would listen to me? And even as a pediatrician, I felt like that.
Sure.
I went to the foundation and I saw Lisa and Sunitha and these like amazing women, and they were giving talks on stage. And I, at that point, back in 2022, had no interest in talking on stage, had no interest in public speaking. Was one that really wanted to be in the background and not really to say any, not any stir any pots or whatnot. And it was Sunitha's mom, who's a pediatrician, who came up and said, "You're a pediatrician. Like you need to use your voice in the American Academy of Pediatrics. Like start there." And so someone saw something in me and empowered me, and that one kind of prompt or his finger in my face was really powerful. And so I think that we can encourage one another to say your
Mm.
voice matters, and you might not be a pediatrician that's going to talk to the AAP, but you could talk to people in your community. You could do an awesome 5K. You could help in some way. You could be a computer person that's on the vaccines, like doing our website. I mean, there's
Right.
there's various ways that we have skills, and it's trying to look at what's your skill set that could help. And I find that for me, I can feel like there's a lot of bad days when my daughter's having bad days. And I kind of fuel those bad days into trying to do something positive and make a difference. And it's given me so much hope. So me being able to be an advocate has been really positive for my mental health.
I was just going to ask you that too, Deb, because you've signed yourself up, you, Sunitha, others, to be the stewards of this, to give your
Mhm,
time and your talent
mhm,
and all these
mhm,
things into this. Where do you find the respite for your own mental health? Is it to continue to be that steward? Is that the way that you kind of work through that? I feel that is something that we haven't actually talked a lot about on this show around sort of the mental health impact. So
mhm,
I'm curious. I'm curious as
mhm.
to what you've seen and observed there.
Yeah, so I think that, when you have a child with a rare disease,
Mm,
you do get a sense that, like, there's nothing that can be done, right? There's
right.
no and as a parent, you just that's a really hard place to sit, to
Mm,
feel like you can't help your child, that there's just, um there's going to be continued like negative outcome that you can't stop. And
Right.
so for me, finding a way to do something to move
Mm,
the science forward, to work towards a treatment, to work towards some answers for other families, makes me feel like I'm doing something. So it
something.
takes an area that you have no control, and you all of a sudden have a sense of control, and just feeling like you're making a positive difference. And so you're going from an area where you just feel kind of hopeless and like, what direction do I go in? And that can be a spiral, to just saying like, well, I can start here. And then when you do, and you see a good outcome, whether it's a connection with another family and being able to give them hope or direction or talking to them, for me anyway, it makes me feel like it's not for nothing, right? Like there's a purpose in all of this. And I think that we as humans want to see that there's a bigger purpose in life. And so for me, being a board member, being on the CACNA1A Foundation has
Mm,
definitely filled me with a sense of purpose. And so I don't feel like having Gabby um, is gonna. I think it's gonna have such a positive impact on so many families, and
mm.
that gives me a lot of great joy.
I love that. I love that. It's and thank you, by the way. Having someone like yourself with this sort of like, and I've seen this with so many of the rare disease moms and dads and caregivers and researchers and and providers.
Mm.
You guys are just knocking down walls like all the time, right? And I'm sure your military training has a lot to do with that and everything. But I'm so impressed at how you're just like, no, we don't accept any status quo. We're just continuing to like knock down walls. So it is amazing. Um, so kind of speaking of action, right? Which I just
Mhm,
talked about knocking down walls, and you're an action
mhm,
oriented person, I can tell. Um, if there's a policymaker that's listening right now, a politician that's listening right now,
mhm.
what's the one thing we say to them so that they can understand and act upon something here when it comes to pediatric neurological conditions?
Yeah, yeah. So I think that being within medicine,
Mhm.
I can 100% recognize that it is a business of medicine. It's
Yeah.
very much about the money. And I think that if you're looking at long term savings to society, there's clearly savings. It's very obvious. There's been so much data on this that's been reported, that when you do an earlier genetic test, you save so much money getting that test done earlier, right? And so what I see is that if I see, the normal journey is about 6 years. In that 6 years, that child is going to see specialist after specialist after specialist. They're going to get a CAT scan. They're going to get an MRI. They're going to get all of these various tests done. And all of that is a charge, right? Like all of that. And so if you would just do the test earlier, you do save money. So it is a cost savings. I think that the problem is that when you look at European medicine, they're looking at the cost savings over a lifetime. And in the US, insurance companies are only looking at cost savings over 5 years. And so in
Mm,
the past, if you did a genetic test and they used to be much more expensive, you might not save money in a 5 year time span. I would say now the testing cost has come so far down that you would absolutely have cost savings even within 5 years. And so I think that's why a lot of insurance companies at this point are covering this
yeah, they're
testing.
willing.
And then I think the bigger question that I would have, and this is going to go a little off topic, I'm sorry, but my
Okay.
husband is an adult doctor, and does critical care medicine. He's an ICU doctor. So
Mm,
he does a lot of end of life critical
mhm,
care medicine. And I am always flabbergasted when there's a question of utilization and cost savings, and if it's worth to do this expensive test in a pediatric patient when it's the beginning of their life and it will clearly impact their health, and end up with so much cost savings with having this information and getting
mm,
interventions done earlier.
mm,
And then it doesn't seem like there's much of a conversation at the end of life. I mean, that person one day in the ICU is going to cost more than a genetic test in a child. They're usually in the ICU for more than a day, right? They're there for weeks upon months sometimes. And I really think the bigger question as our society is like, where do we want to put our healthcare dollars?
mhm.
And I think the problem has always been that we have never given enough money to improving health. We
Yeah.
are very much disease focused. When the disease is there, then we throw a lot of money into trying to fix the problem. And as a pediatrician, I'm already just on board with like preventative medicine and
Well,
trying to improve health and doing things from the beginning. And so I think for a society, it's so much better for a society to put money into the beginning of a child's life and into getting a diagnosis and doing the testing and getting the therapies so then they can be, a part of society, need less resources as they get older. And certainly the trade-off is so much better because they're going to have their whole life to appreciate that cost of that medical intervention versus a lot of money spent the last month. And then that person often still passes
who
away,
passes away.
delay.
Yeah.
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 Anyway, I think a lot about class utilization, and it's surprising to me. I don't know who's looking at big picture, but I think there's societal questions of we seem opposed to limiting end of life care and letting
Mm.
people die with dignity, and we because we don't really think about the cost of that.
I can really empathize as someone who personally has worked on, maternal programs, early child intervention programs, and sort of investing in prenatal health, maternal health, to then lead to, healthy babies being born, to then doing early intervention on those babies to keep them healthy. I'm with you, Deb. I hear what
Mhm,
you're saying. I
mhm.
really have a lot of empathy towards you in that. And good on your husband too. What a tough side of medicine to also work on when you're seeing the sickest of the sick all the time, right? So
Yeah.
thanks to him as well. Deb, before we let you go, I just want to make sure that folks are able to get in contact with the foundation, website, socials. Is there anywhere that you want to make sure that people go and take a look at, see if they can somehow get involved, the 5Ks, what's the easiest
Mhm.
thing for folks to do?
Yeah, great question. So we always encourage everyone to go to our foundation website.
Mhm.
If you Google CACNA1A, CACNA1A, typically one of the first websites is going to be CACNA1A.org. And that's going to be the CACNA1A Foundation website. On there, there's contacts that you can directly contact through the website. And then there's a lot of information on ways to get involved, to get your name added to our email list is a great way. Anybody listening, if they just go on and add their name to our email list, then every month we send out an email and it's a good way to see what's going on in our world.
Perfect. Perfect. Thank you. Deb, thank you for your time this morning. I really appreciate it. I know that the rare disease community will get a lot out of listening to this conversation. And before I let you go, I want to wish you a happy early Mother's Day.
Uh,
You did say you're a mom of three, and that's a job in and of itself every day, but I'm sure it's a good job, right?
yes, yes, the best job in the world. I wouldn't trade it for anything. I love being a mom. I love being a pediatrician mom. I love being a rare disease mom. So thank you so much for taking the time to talk with me today. I appreciate it.
You're very welcome. Take care.